Hello, On Our Own of Maryland conference. My name is Dan Rabbit. I'm the policy director for the Greater Baltimore Regional Integrated Crisis System, or GBRICS partnership. I've been on board here at Behavioral Health System Baltimore for the last couple of months, and I'm really excited to share this new opportunity to improve our behavioral health system and improve the care that we provide people who are living with mental health or substance use challenges. The GBRICS partnership is a part of BHSB, Behavioral Health System Baltimore, which is the local behavioral health authority in Baltimore City. We're a standalone nonprofit, but manage the public mental health and substance use system in Baltimore. The GBRICS partnership came together almost 2 years ago now as a partnership across 4 jurisdictions: Baltimore City, Baltimore County, Howard County, and Carroll County. And the partners represented across that region is pretty impressive, with 17 hospitals, the local behavioral health authorities in all of those counties, peers, consumers, and providers of behavioral health services, and many other partners. And why we were able to bring together such a diverse group of folks is to pursue a significant investment in the behavioral health crisis response system across Maryland. This system responds to people who are having a mental health or substance use related emergency and provides mobile crisis teams and call centers and non-law enforcement or hospital related responses. This investment is designed to improve our ability to provide care to folks who are having a crisis, as well as to reduce a reliance on hospitalization and law enforcement involvement. We know that calling 911 and having police come to your door is not usually the best response when someone's having a crisis. But we don't have the capacity always to be able to send alternative responses to the folks who are having these crises. So the GBRICS partnership is an exciting opportunity to really scale up those services and help people get the care that they need in the community when and where they want it. So that's sort of a quick overview of it. The grant started this year in calendar year 2021. We have 5 years to accomplish our goals with the GBRICS partnership. So with that, I'm going to pass it over to my colleague, Shauna Brock, to walk us through the particulars.
Hi, everyone, and thank you so much for this opportunity. We really value the partnership of On Our Own Maryland. My name is Shauna Brock. I'm the Director of Implementation for GBRICS. And just like Dan, I've been with Behavioral Health System Baltimore for a few months. I was brought on to work on this project. I am a clinical social worker, and most of my experience has been working with adults who are experiencing homelessness. I also I'm a mom of a family member who's been experiencing some mental health crises, so I now have some firsthand experience with the gaps in the system. So I'm very pleased to be able to work on this. So there are 4 main components of the GBRICS model. First, we are going to create one behavioral health crisis hotline for the region. And the difference of this hotline is really the new software, which is the Crisis Now model software that'll create faster, direct connections to get people to the right service that they need. We are going to have a really large increase in mobile crisis teams around the region, so that we can provide 24/7 access and also use some of those funds to provide services where there are gaps, such as for children or people with intellectual or developmental disabilities. We will be able to, this system, be able to schedule same-day appointments. So, for example, if someone calls in the middle of the night, we should be able to get them an appointment that same day, later in the day, during the daytime hours, through 24/7 appointment scheduling. And then another big component where we'll need a lot of help from the community is to raise awareness about the new number and the new system, so that we will be able to provide a real alternative to people instead of calling 911 or going to the emergency room. And I know a lot of you are familiar with the Crisis Now model, and that's the model that we will be following. So we are hoping, as most models do, to resolve 80% of the calls on the phone. So when someone calls in crisis, oftentimes they just need someone to talk to. And we will also be able to divert 911 calls to our system. From our system, we'll also be able to dispatch mobile crisis teams. And again, a lot of those calls will be resolved in the field. And we'll also have the mobile crisis ability for law enforcement to be able to divert to us as well. And really the whole purpose of the system is reduce the use of jails, emergency departments, inpatient, reduce the use of law enforcement, and really have the least restrictive level of care to be able to provide care to people in the community. So that's the GBRICS model, and we really hope that you will participate with us. In order to get involved, you can email either me or Dan, and here's our contact information. And we would be happy to have you join any of our work groups or subcommittees, or just get on our mailing list so you can stay informed. Thank you so much for this opportunity today, and we look forward to working with you.